Hello everyone, welcome to my video. It's made by the Butterfield Agency. I'm the owner and Medicare and life insurance problems. So in today's video, Medicare is changing again, but not in the way that headlines tell it. Over the next 36 months, quiet shifts are about to reshape how care is delivered, paid for, and controlled. There's a lot of noise out there, rumors, half-truths, there's clickbait and confusion. I've spent the last year sorting out the signal from the statics. This video is your shortcut to what really matters and why it starts now. Despite widespread headlines and speculation, it's important to focus on verified policy facts. It's going to get worse, but I'm going to be here to help along the way with resources that will allow individuals and people that help individuals adapt to and plan for Medicare's new landscape. With these changes, what's really changing in Medicare in 2026 and beyond? Medicare changes are going to significantly impact beneficiaries. Understanding the updates are crucial to be able to make informed decisions. Key changes include coverage expansions, cost adjustments, and this video is here to remind you to stay aware of the new policies affecting healthcare access. That way you can separate factual information from the misleading narratives and give you the ability to make a decision based on something that's more than just what somebody else is telling you. There's three quiet shifts most seniors haven't heard about. One is that VBID benefits will end in December 2025. There's going to be more on that in the next slide. Starting in 2026, Congress is tightening the budget belt fast. New laws could cut over $500 billion from federal health spending over the next 10 years. How does that affect you? It means that there'll be more rules on what doctors can offer, fewer options covered by plans, and faster changes to what counts as necessary services. Medicare's top agency gets power to approve or deny things like extra benefits, prescription help, and which providers are in your plan, and they'll be doing it faster with less time for public input. One of my clients used her Medicare plan to get free rides to physical therapy twice a week. Then one year, she got in a situation to where she didn't really pay attention to the changes that were happening on her plan in the ANOC that came out every year. And she found herself at the curb waiting for a ride that never showed. We flagged the update. We helped her switch plans during the open enrollment period, and we kept her therapy on track without another single missed session. Starting in 2026, these changes are going to come faster, quieter, and they're going to be harder to fix after the fact. And that's why this series is here to help you stay ahead of them. Let's cut through another layer of confusion: enrollment. There's a proposal on the table that could change how people are placed into Medicare plans. If you miss the annual sign-up windows, new rules could assign you the plan based on your zip code and not your actual needs. This is just a bill. It's HR 3467, but it is gaining traction. It would auto-enroll folks into the largest local plan if they didn't make a choice. And that might sound convenient, but it could mean fewer benefits and more red tape to switch later. In at least 18 states, Medicaid users under 65 could also be required to report 80 hours of work each month to keep coverage and be auto-assigned to a managed care plan. These ideas aren't law yet, but they're moving, and that's why I'm watching the details and sharing what's real and what's just noise. If HR 3467 does move forward, I'll release a follow-up video that'll walk you through what it means and how you can stay in control in your particular situation. So, VBID is ending. SSBCI is taking over. What is VBID and SSBCI? Medicare's VBID program is where some plans covered things like groceries, rides, things that were outside of just the normal health care. That VBID plan is going away at the end of 2025. Now, that doesn't mean that those extras are going to be gone for sure. It's just showing up in a new form. Starting in 2026, state run Medicare plans for people who qualify for both Medicare and Medicaid will offer personalized support, things that help with housing, meal plans, transportation. They may still be covered, but now the states will decide who gets them and how. These new rules make care more coordinated, but also more strict. If you're in a dual plan or thinking about one, something with Medicare and Medicaid working together, expect changes this year, the end of 2025. Expect changes in how you choose your plan and how you manage your care and what extras are included. Now, some of my clients, like I said, they rely on Medicare Advantage plans to cover things, the rides, the over-the-counter items, the foods, the extras. One client in particular called me because she heard that people with Medicare and Medicaid might lose those extras in 2026. That's something that she read on a headline somewhere or saw in a video or saw in an advertisement. There are changes coming. We don't really know exactly what they look like as far as who's going to be eligible and who's not, but there'll be a list that's put out, and that information as we get closer to October 1st will become more available. With her, we just set up an appointment for after October 1st, once the carriers release the 2026 planes, and that way we can look at her exact situation and decide what to do before the October 15th annual enrollment period begins. And then we'll have time between October 15th and December 7th to make sure that we find the fit that's the correct one for her. Instead of spending her summer worrying about all the alligators in the water, she's got peace of mind and a guide who's on his game. $500 billion in cuts. How does that hit if that goes through? Significantly, it's going to reduce. This is going to make quicker decisions with limited public feedback. Plans will have reduced flexibility in their benefits. A client that I had experienced a sudden loss of her ride benefit. We had to fix that. So better preparation is crucial for navigating upcoming changes and making sure that something doesn't just happen, that you know what's going on. One of the rules, the HR 3467, could lead to automatic plan assignment. It may change how beneficiaries not only are assigned plans, but limiting choices, and this could result in fewer benefits and make switching plans more complicated. Additionally, changes in Medicaid requirements may impact those needing to work a minimum number of hours, which could affect their access. Again, these are things that are potential. Not everything's gone through yet, but you want to be aware of them so that you know what's going on and how to react to them, or how to make sure that you're not falling in a situation that might be more difficult than it needs to be. And that's why I'm tracking it closely. I'm making sure that I watch the rollout of the SSBCI from the VBID. I'm monitoring that and the status of the auto enrollment bill. I'm making sure that updates on Medicaid, I'm familiar with them and what the work rules will look like, and how that might impact some of my Medicare and Medicaid clients that have the dual plans. My next video will break down new developments if the laws pass or as things go through. So just to recap, VBED ends in December 2025. SSBCI begins implementation in January 2026. Budget changes will happen quickly. Enrollment shifts may be overwhelming, but support is available through this transition. Save my info so you don't miss out. Like and subscribe on YouTube. Bookmark thebutterfieldagency.com. It's www.butterfieldagency.com. Save my cell phone number, 509-703-5655. You can get me at that number any day but Sunday. Follow me on Instagram. You can connect with me on LinkedIn. You can follow my page and like me on Facebook and follow my Facebook. Ultimately, when you're dealing with me, you're just dealing with me. Not bots, not scripts, not call centers. Just one real person helping real families. Dig deeper. How can you look into some of this stuff on your own? Make sure that the stuff that I'm putting on here is accurate. First of all, your starting point should be www.butterfieldagency.com. You should also, if you want to, visit medicare.gov. Check CMS Newsroom for rules and updates. Track HR 3467 on congress.gov. Medical policy, KFF. You don't have to click every link. You can look into it a bit for yourself and do your research, but always lean on me. Give me a call, send me an email, set up an appointment. Let's make sure that you're not spending your time this summer worrying about things when you could be spending it with your family and enjoying the beautiful weather that we get here. Again, if you have any questions, reach out. There's going to be more videos in this series, but just stay connected, stay plugged in, stay on my radar, and let's make sure that you're not someone that slips between the cracks and gets stuck on the side of the curb. Thanks so much for watching, folks. As always, I'm here to help, and feel free to reach out. There's no cost to you for my services. The insurance companies pay me for helping. So thanks a bunch, guys. Have a wonderful day.